Hello guys, so now we shall be discussing what are the different kinds of extraocular muscles which you have. Okay, so our topic of discussion would be regarding the extraocular muscles. Okay, now regarding these extraocular muscles, what are extraocular muscles? Extraocular muscles are the muscles which are located surrounding your eyeball. They are called as the extraocular muscles. So how many extraocular muscles we have got? We have got 7 extraocular muscles. Okay, so what are these 7 extraocular muscles? First of all, let me write down the names of all these 7 extraocular muscles and then we will discuss in detail. Okay, so the first important extraocular muscle is levator palpebrae superioris. Levator palpebrae superioris. Okay, the first extraocular muscle is levator palpebrae superioris. Now the second important extraocular muscle is the rectus muscle. So what are the different kinds of rectus? First of all, let me write it down again and then I'll explain you with the help of a diagram. Next we have got the rectus muscles like superior rectus. Okay, next we have got the inferior rectus, inferior rectus muscles. Okay, fourth important thing is medial rectus. Fifth important thing is lateral rectus. Sixth important thing is superior oblique. Superior oblique. And seventh important thing is inferior oblique. Inferior oblique. So how many muscles totally we have got? We have got 7 important muscles, right? Now out of these all 7 important muscles, first important thing is levator palpebrae superioris. So the name itself tells that this, for example let us say this is your eyeball. This is your eyeball. Okay, and so if this part is your eyeball all the way like this, okay, and this part over here, this part will be called as your eye palpebra, right? So this part over here will be called as your palpebra. So this is your palpebra or your eyelid. And where is your eye exactly present? So this is the position of your eye. So this particular thing over here is your eyeball. Okay, so this is your eyeball over here. Clear? Now if I want to lift my eyebrow, so if you look exactly on the surface of eyebrow here, you have got a muscle. So if I am closing my eyebrow, right? So for example, if I am closing my eyebrow like this, so this eyebrow is having a muscle over here. Now when I contract this muscle, what is happening? My eyebrow is elevating like this, right? The upper eyelid is elevating like this. So this eyelid is called as superior palpebra and the eyelid that is located down is called as inferior palpebra. So on the superior palpebra you have got a muscle called as levator palpebrae superioris. Why are you calling it as levator? Because the action is levation. Levation means elevation. If this muscle will contract, then my eyes will open like this, right? The eyelid, the upper eyelid is opening up. So what is the action of this? What does this do is that this is responsible for the upper eyelid movement. This is responsible for the upper eyelid movement. Upper eyelid movement. Okay, so what does it do? What is the responsibility? That is your elevation of the eyelid. So it elevates the eyelid. This elevates your eyelid. Okay, so this is called as superior levator palpebrae superioris. Now after this levator palpebrae superioris, you come across the next group of muscles, right? So what are these muscles? One is called as the superior rectus, inferior rectus, medial and lateral rectus, superior and inferior oblique. So all these muscles, the remaining 6 muscles whatever you have, they are responsible for the movement of your eye. For example, I can look up, I can look down, right? I can look right, I can look left, I can look right. So all these movements, right, I can even rotate my eyes. So all these movements are done by these 6 muscles. So they are responsible for eye movements. They are responsible for which movements? They are responsible for the eye movements, right? So let us draw down these eyeballs over here, okay? So let us say that this is your eye, okay? And let us say this is your eyeball in the center, okay? And let us also tell that this is the nose. This is the nose. Now here there are a group of muscles, right? So there are a group of muscles. These group of muscles are straight and they are present on the top of the eyeball. So these group of muscles are present on the top. So I have to call them as superior. And if they are straight, it means in Latin the straight things are called as rectus. So these muscles are called as superior rectus. Next, down here we have got another group of muscles. This is called as inferior rectus. One is called superior rectus, another one is called as inferior rectus. Next, towards the midline of your body, towards the nose is your towards the midline. So this muscles towards the midline or the nose is called as a medial rectus. Away from the midline, these group of muscles over here are called as your lateral rectus. Okay, so what are the different rectus muscles over here? So this one is called as a superior rectus. Okay, this is called as your inferior rectus. This is called as your medial rectus. This is called as your lateral rectus. Additionally, we have got 2 more muscles. For example, here we have got this particular muscle, you can see. In the same way, down here also we have got this particular muscle. So the muscle which is located over here is superior and it is oblique. So superior oblique. The muscle which is located down is inferior oblique. So how many muscles totally? We have got 6 muscles. So superior rectus, inferior rectus, medial rectus, and we have got superior oblique and inferior oblique. So out of all these muscles, most of the muscles, leaving 2 muscles, most of the muscles have got 3 actions. What are these 3 actions? Primary action, secondary action and tertiary action. So what is the primary action? All of you know what is the primary action over here. First thing, superior rectus, if it will contract, the eyeball is deviated upward. This is the action over here. Second action, what you know, if inferior rectus is contracting, then eyeballs are looking downward. Okay. If medial rectus is contracting, then the eyeballs are looking medially, and if lateral rectus is contracting, eyeball is looking lateral. In the same way, the superior oblique as well as the inferior oblique. Now, apart from these actions, these are some of the actions which are very simple. Apart from these actions, there are 2 more actions. So, what are the actions? We shall look here right now. So, what are the muscles over here? So, let us write down these muscles. First is your superior rectus. Next you have got is the inferior rectus. Next you have got is the medial rectus. Lateral rectus. Superior oblique. Inferior oblique. Superior oblique and inferior oblique. Now coming to this superior rectus, primary action, secondary action and tertiary action. What are the 3 actions? For example, when you look at the primary action, superior rectus is responsible for the elevation of the eyeball. It is responsible for what? It is responsible for the elevation of the eyeball. Next, secondary action is, it is responsible for intorsion. What do you mean by intorsion? Intorsion is inwardly, medial direction. If the eyeballs have to look medially, that is called as intorsion. Intorsion is inward, extorsion is outward. Okay, so intorsion of the eyeball. And third important thing, it is also responsible for adduction of the eyeball. Adduction of the eyeball. So 3 actions: elevation, intorsion as well as adduction. When it comes to inferior rectus is responsible for depression. Depression of the eyeball. If it is intorsion above, the opposite will be extorsion. Extorsion, right? and adduction is also done by the same muscles, that is superior and inferior rectus done adduction. Okay, so superior is the opposite of inferior. Next, when it comes to in case of intorsion, extorsion, elevation and depression only. When it comes to medial as well as lateral rectus. Now medial rectus and lateral rectus, they don't have secondary actions, they only have one action, either adduction or abduction, right? So medial rectus, where it is present here, if medial rectus is contracted, then the eyeballs move towards each other, right? So this is called as what? This is called as abduction. If the lateral rectus is contracted, then the eyeball is moving laterally, this is called as adduction. Okay, so two actions, one is called as adduction, next one is called as abduction. Abduction. Okay, so when I tell about adduction, this is how the picture looks. Medial rectus, right? So adduction. So the eyeball is looking medially here. When it comes to abduction, the eyeball is looking laterally. This is called as abduction. Okay. Next, when it comes to, I mean not this one. This is called as squint. Okay, this is called as squint, where both the eyeballs are looking on the either side. So this happens only when your medial rectus muscle is paralyzed. Okay, what I am telling is that, for example, if I am looking right side, right, my lateral rectus on the right eyeball is contracting and medial rectus of the left eyeball is contracting. That is how both the eyeballs are equally looking to the right. Okay, so this, what is this action I mean? For example, I'll draw it like this, you'll understand. So what do I mean is that, for example, this is also an eyeball, right? So one eyeball, if it is looking laterally and the other eyeball is looking medially towards the center, right? So this eyeball action is done by the lateral rectus, but this eyeball action is done by the medial rectus. That is what I mean. The opposite again, if this eyeball is looking other side and this eyeball is looking on the other side, again the muscles will change. Okay. Next, when it comes to superior oblique and inferior oblique, they have got different actions. For example, superior oblique is responsible for intorsion. Intorsion. Opposite of intorsion will be extorsion. That is done by inferior oblique. Extorsion. Next, superior oblique is responsible for depression of the eyeball. Depression of the eyeball, whereas inferior oblique is responsible for the elevation of the eyeball. Elevation of the eyeball. Okay. Next, here we have got the abduction. Abduction, opposite is again here abduction only, there is no opposite, abduction. So both of them does the abduction. So here I just have to change the arrows. So one is responsible for this action and one is responsible for the elevation. Inferior oblique is responsible for the elevation. Okay, right. So this is the thing. Now all these muscles actions are done, but what is the nerve that is supplying these muscles? The nerves that are supplying these muscles are basically three. Okay, so you just have to remember it as SO4 LR6 R3. SO4 LR6 R3. What is this SO4 LR6 R3? SO4 in the sense superior oblique muscle is supplied by fourth pair of cranial nerve. What is fourth pair of cranial nerve? That is your trochlear nerve. Fourth pair of cranial nerve is your trochlear nerve. Next, LR6 in the sense lateral rectus. Lateral rectus is supplied by another pair of cranial nerve, that is 6. What is 6? 6 is nothing but your abducent. Abducens nerve. Okay. In the same way you have got R3. R3 in the sense the rest, remaining, leaving superior oblique and lateral rectus, remaining all muscles whatever are there are supplied by third pair of cranial nerve. What is this third pair of cranial nerve? This is called as oculomotor nerve. Oculomotor nerve. Okay. So these are the three important things which you need to know. So what are the things we have discussed? We discussed regarding the extraocular muscles. As I have already told you, extraocular muscles are completely 7 in number. So the first important muscle is your levator palpebrae superioris, that is responsible for the upper eyelid movement, elevates the eyeball. Next, so it elevates the eyeball like this. Okay. Responsible for the elevation of, not the eyeball, elevation of the eyelid. Okay. Next important thing is the superior rectus. After that we have got the inferior rectus. Next, medial, lateral, superior oblique and inferior oblique. All of them are responsible for the eye movements. Next, coming to their actions over here, superior rectus is opposite of inferior rectus, elevation, depression, intorsion, extorsion. Medial rectus is adduction, lateral rectus is abduction. So adduction is also done by superior and inferior rectus also. Okay, all of them do adduction. Next, lateral rectus is abduction, and superior oblique and inferior oblique also do abduction. Okay, apart from that, there are other actions here. Coming to the nerve supply, you have to remember it as SO4, LR6, R3. SO4 is superior oblique supplied by fourth pair, that is trochlear. Lateral rectus is supplied by the abducent, and the rest are supplied by oculomotor. Third pair of cranial nerve is oculomotor nerve. Okay, so these are some of the important things which you need to know regarding the extraocular muscles. So thank you so much for watching my video. Goodbye.